A 2014 World Health Organization study claims that global warming would cause at least 250,000 deaths per year between 2030 and 2050. These figures arm the case for immediate and far-reaching policy action to mitigate climate change. However, an examination of the WHO's methodology and its underlying assumptions reveals that the study overestimates mortality from global warming several-fold. The WHO's estimate is produced by a model which combines estimates of future temperature and precipitation with estimates of population change and economic development. But according to the IPCC, the warming scenario used by the WHO is based on climate models that run at least 3 times hotter than observed warming. Also, the WHO study does not give future economic and technological development their full due in increasing adaptive capacity to cope with the adverse impacts of global warming. Adaptations, enabled by a combination of economic and technological development, reduced global mortality rates from malaria by more than 5-fold in the past 60 years, and global mortality rates from extreme weather events declined 20-fold from the 1940s to the 2000s. The WHO study does not seem to believe that past is prologue in this regard. It only partly accounts for future economic development. And it assumes explicitly or implicitly that the most vulnerable populations will not take advantage of future technological developments to reduce mortality rates from global warming. The WHO's assumptions also ignore the possibility of simple common sense adaptations that any individual or society should be expected to undertake in the face of adversity, whether due to climate change or any other factor. These adaptations include measures to control disease and early warning systems that would rely on modern communication networks, things that would almost automatically be created as any economy developed, with or without climate change. To summarize, the WHO exaggerates future mortality increases that can be attributed to global warming. It uses climate models that run too hot. It downplays the ability of economic and technological development to advance adaptive capacity and cope with the adverse impacts of global warming, and it assumes that future societies will forego obvious adaptations. Taking the WHO's results seriously risks skewing global priorities. It could divert scarce funds towards greenhouse gas mitigation instead of directly dealing with poverty-related diseases and vulnerability to extreme weather. This would be less effective and could worsen the underlying risk factor, namely poverty.